Hey guys, today's topic is esophageal carcinoma. So I will be discussing briefly about esophageal carcinoma. Let me start. Okay, important points. What you need to remember is in Usmle is they give the history of a patient with the first initially he had a difficulty swallowing solid foods, then nowadays he is having difficulty in swallowing liquid fluids. That's very important. History of weight loss, hoarseness, hypercalcemia. Okay, investigations, just I want to tell you, it should be in the next topic. Okay, investigation. What you would like to do if you are suspecting a patient gives a history of esophageal carcinoma suspected, you are suspecting this could be a esophageal carcinoma. How do you proceed? Sometimes they give the history of a smoking, so smoking causes squamous cell carcinoma, right? So very common of a squamous cell carcinoma, and Barrett's esophagitis that causes intestinal metaplasia that causes adenocarcinoma. How do you remember? Intestinal metaplasia that occurs in the what is the location actually? The what you call smoking, so it causes in the upper part of the esophagus, whereas Barrett's esophagitis, the metaplasia is in the lower part of the esophagus. Okay, remember this. So how do you proceed? First is a barium or endoscopy. Tell me which one you want to do and why. It's the first step. Remember, first step is always a barium. Why barium? Because you need to know if there is, because you need to locate if you start with the endoscopy, you can puncture, remember. So sometimes first you need to do is a barium studies, try to know the path, try to track it, how it is actually, where is the lesion and everything, right? So once you know the lesion, and then you can proceed with the endoscopy. Okay, why we do CT? Why you want to do the CT after endoscopy? Once you started with the barium, then you did endoscopy, then you want to do CT. Why? Because you need to know, is there any other involvement? Like endoscopy only detects within the esophagus, right? We need to see other than esophagus, beside the esophagus, is there any involvement, is there any metastasis? That's very important. So how do you do staging? Staging can be done by endoscopy or ultrasound. Okay, so this is very important point what you need to remember. Okay, last part is a treatment. I haven't written here, I'm very sorry for that. So treatment is just a surgery. So chemotherapy with 5-fluorouracil with radiation can be used for a distance metastasis. Okay, thank you so much for watching my video. Please do subscribe, please do subscribe, please do subscribe. Thank you.